Hi everyone, and welcome to a beginning of a new week. My name is Steve Stump. I'm a licensed health insurance agent with Revolt Healthcare Alliance, and we are just a week away from open enrollment. So I thought I would talk about a topic that a lot of us are hearing a lot of news about, especially with the election just around the corner, and that is pre-existing conditions. Very simply, pre-existing conditions are known as any medical condition you have before you get health insurance. And the Affordable Care Act required that insurance companies that offer compliant plans had to cover pre-existing conditions. But many of Americans do not have pre-existing conditions, and now you have options entering into this open enrollment period to seek out plans that meet your needs without covering pre-existing conditions, which you might not worry about. So a few years ago, the Kaiser Family Foundation did research across the insurance and healthcare space and learned that 16% of our population spends $0 on healthcare spend, even though they may have health insurance. So these individuals obviously don't have pre-existing conditions and don't have a need to see a doctor on a regular basis. Furthermore, they learned that 50% of our population only spends about $310 a year on their health care. And even more so than that, 75% spend less than $2,300 on their health care. And so the options that are in front of you now is to enroll in plans that are underwritten and aren't required to cover those with pre-existing conditions. When you get into an Affordable Care Act plan, that plan, I guarantee you, must cover pre-existing conditions. And so if you're a relatively healthy individual in those plans, you are paying for those that need the pre-existing condition coverage. If you don't have those conditions and you don't see a doctor on a regular basis, other plans like an indemnity-based plan might be a better fit for you. These plans are underwritten and the carriers can choose who they want to insure and who they don't. Because they don't insure the chronically ill individuals of our country, these plans typically bring premiums 40 and 50% lower than your Affordable Care Act plan premiums. So these are options that you have other than the Affordable Care Act that can allow you to bring your premiums down, still have great coverage, and if you don't have pre-existing conditions, it's not an issue. Now, a lot of people think, well, I have a pre-existing condition, I have to be in one of these plans. And that's not necessarily the case. If your condition is not chronic, meaning you don't need to see a doctor several times throughout the year, then now you have an economic decision to make. If you get into a costly high deductible plan that's ACA compliant, you're going to have to meet that deductible before your benefits kick in. Deductibles can be as high as $3,000. I've seen $5,000. I've even seen $6,000 and $7,000 individual deductible plans. So let's just take the $5,000 deductible plan. If you have a mild pre-existing condition that requires you to see a doctor on some regular basis throughout the year, but not frequently, you're going to have to spend $5,000 before the benefits kick in on that plan. When you look at your options, an indemnity-based plan that brings your premiums down by 40 or 50%, and still you may have that out of pocket because the exclusion period for pre-existing is at least 12 months, then it may make more economic sense for you to be on a different plan other than an ACA compliant plan. There's a lot of options that people just don't know that are out there when it comes to health insurance. The best thing that can happen to you is you get stumped on your health insurance. To learn why, insure with me, Steve Stump. I hope you found this beneficial. Have a great start of the week, everyone. And if you have any questions about health insurance entering into open enrollment, feel free to reach out to me. Thanks. Have a great day.